2024 to order. The first order of business is the agenda or the minutes from our previous meeting, 12/18 of 23, copies of which are in the packets. Does anybody have corrections or updates that they need for the minutes? If not, I'll take a motion to approve them. Motion from Henke, is there a second? Second from Larson. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye. Opposed? None are opposed. Minutes are approved. Item number 2 is to consider approval or denial of various license applications. There are no denials for this month. So does anyone have any questions about the licenses? That was actually a fairly short list this month that are recommended for approval. If not, I'll take a motion to approve or deny licenses as recommended by staff. Motion by McElhaney, is there a second? Second by Dinny. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye. Opposed? None are opposed. That motion carries. Item 3 is discussion and take possible action on re-reviewing our recommendation to issue a summons with regard to the Class B beer and liquor license of Kevin Stanky doing business as Campus Pub, premises located at 1110 West Campus Drive in Wausau, due to the sale of the business and a voluntary surrender of the license. You'll recall at our last meeting, we had directed staff to begin the process to issue the summons to revoke that license for not being open. Since then, the clerk's office has been in touch with the owner and has found out that premises has been sold. And so the new owner, the prior owner has surrendered the license, and the new owner, I guess, is working on or planning to apply. Obviously, we'll post that license, and anyone can apply for it that may want to compete for it. But the Liquor License Review Subcommittee would take all of the applicants and then make a recommendation at a future meeting for you with regard to that one. So it appears with the surrender, we would not have to pursue that hearing process. We have it for action, but I guess. What do you think, Tegan? Do we need to vote to repeal that process that we had started, or do we agree by consensus that we want to put that on hold?
I think that it's fine to agree by consensus. We do have the voluntary surrender of that license, so with the surrender, that kind of puts the whole revocation hearing process, it kind of makes that moot.
Yes.
So
Okay.
I think we just wanted to put it on the calendar so that everybody, or the agenda, so everyone knew what was going on with that and understood why
Okay.
the city didn't proceed.
Didn't send the notices? Yep.
Yeah.
That makes sense. So I guess we'll agree by consensus then, committee. Are we okay with that? The city's in possession of the license, and we'll get it advertised and take applicants, including the new owner? Okay. It looks like thumbs up from the committee, so we're good on that. So we won't need to act on item 3. Item 4, discussion and possible action on amending Wausau Municipal Code Title 19 Plumbing Code. And you see some updates in the packets on that. And Bill Hebert is with us if you have any questions on those items. Looks like we've got some house cleaning things. Looks like to clean up the code a little bit as far as permits and things. Does anyone have questions on that at all? Go ahead, Lou.
I don't have any questions. I read through it and I find it to be appropriate. I find it to be okay. So I'll make a motion that we approve the changes.
Okay, we have a motion to approve from Larson. Is there a second? Second from McElhaney. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye. Opposed? None are opposed. That motion carries as well. Item number 5 is the operations report for the fourth quarter of 2023 from the police department. Anything notable on the report that you would like to ask Captain Baton about? Anything that you wish to talk with us about? Todd? Welcome.
Thank you. Yes, I appreciate the opportunity. In addition to Chief Barnes's comments here in the chief's message on the operations report, I just wanted to make mention that members of the command team were able to attend the recent Wausau Emergency Police Auxiliary Banquet on Saturday evening, and they presented us, as they do each year at that setting, with a certificate with the total volunteer hours that unit had provided to the city. So it is my honor to announce that the Wausau Emergency Police Unit volunteered a total of 1,763.75 hours for 2023. And without their service, this is an all-volunteer auxiliary. Without their service and commitment to keeping our citizens safe at many of our special events, I'm just not really sure how we'd be able to staff those events with our sworn staff. So we certainly appreciate the efforts of our auxiliary unit in the EP.
I think it's important too, I mean, at the committee level too, that we celebrate the efforts of the emergency police. It is beyond a worthy effort. I think if we would multiply out what it would cost for us to staff uniformed officers at those events that, they've put in so many hours for, it is an astronomical amount of savings to our budget every year. And I mean, certainly I think that, they've gone through ebb and flow where they've had, some difficulty in recruiting, and they've had, it's a lot of work for the people that do it, but it's definitely a worthy effort. And so I think it's important out in the community that we celebrate their volunteer hours. So thank you for that report. Anything else on the report committee that you would like to discuss? If not, we'll place the report on file. We don't need to act on the report. Item 6 is the operations report from the fire department for the month of December. Anything that you want to talk with us about, Chief Cobb?
I do have a couple things that I wanted to go over real quickly. This morning we met with the Police and Fire Commission, and I had brought this up. I know a couple of years back we went to this monthly report, and I wanted to see what your guys' opinion was on that. I spoke with Police and Fire Commission, like I said, and they were willing to allow us, after I explained talking with the other management staff, of going to a quarterly report and a more in-depth annual report. Just something I kind of wanted to see if you guys really enjoyed the monthly report. We feel like it's a little repetitive, and would like to try out the quarterly report for 2024.
Okay, what are your thoughts, committee? Go ahead, Doug.
Yeah, wouldn't be opposed to that. I guess if there's something significant, though, we'd want that supplemental report in between, I would think.
Sure. I think that, well, we like all of your reports, but I think that if it presents an opportunity to relieve some of the cyclical pressure on your office staff to create the report on a monthly basis, I think I would be up for having it quarterly. I mean, obviously, if something comes up in between, we can always, stick in a report or an anecdotal update, but I think quarterly is fine.
I agree. I appreciate that. And I think it opens it up for myself or the deputy chief to come in and talk about even more current things than what happened maybe the month prior, say something in January. Right now, we're almost through January, and I have to focus on the report for December. I think it opens that up a little bit to just be more of an open book to you guys when we're in these meetings by doing it quarterly also.
Oh, certainly. Yep. And I think in the context of the reporting too, obviously, even offline outside this setting, if anyone sees things that are either happening or happened and they have questions, they can certainly contact you between meetings and find out those answers as well. So,
Perfect.
okay.
And then if you have time, I have two things to add that I
Yeah,
want to brag
go
about
ahead.
a little bit.
You have the floor.
We have our first firefighter who's gone through Task Force 1 training. As you know, it's another specialty team that we've made the endeavor with the state too, that they'll deploy on big emergencies throughout the state. They want to have 4 of them from the city of Wausau at some point. Autumn Mortel just got done with the extensive training at Volk Field, which was 4 or 5 trips down there, anywhere from 3 to 6 days apiece. Very intensive training, and she is now certified as a Task Force 1 member. And we are starting a second member, Lieutenant Ted Touches, who will be stepping down from the Thames team and joining Task Force 1 and going to the training here at the end of the month. So in the next couple months, he'll be certified as a Task Force 1 member also. So I wanted to make note of that. I don't think that was in the report. And I also wanted to make a quick note. Very cool, we've gone through this whole transitional year with the students going through EMT Basic, getting their paramedic certification. Very exciting time for us. Got all 8 of them through the academy, and now there are 8 brand new paramedics running as a third person on the ambulance for 10 24-hour shifts. In one of his first shifts, Kua Zhang, our very first Hmong firefighter in the city of Wausau, was able to respond, and I don't even know that they know that I saw this, but it was in Guardian Tracking. And he made a note in his journal that he responded to an unusual call where the lady was Hmong and didn't speak any English, nor could she see. She spoke Hmong but was unable to be, and he was able to be the primary caregiver to provide her with a treatment plan and transport her to the ER. We do have software to be able to translate amongst us with people that are with different languages and different barriers such as that. And this was one where it was unable to do, and without KUA, it would have been even more challenging. So not only did he help with that and get the patient to the hospital, but 1 hour later, the hospital asked our ambulance crew to return to help with patient care because they couldn't communicate with this patient. So I just wanted to take a moment and recognize that in his very first shift, he's made a huge difference in the city of Wausau and in our community. So it's great to see those sort of things coming together.
It's amazing. How comforting for the patient, too, to be able to have someone that could offer that care and communicate right away with her. So,
Sure.
Excellent. Love that. Any other questions or comments on the fire report? If not, we will place that report on file as well. Item number 7 is the Tavern Activities Report for the month of December. Looks like a fairly routine month on the report. Did anyone have any questions on items that they saw in the report? I don't think anything really seemed too out of the ordinary with that. We'll place that report on file as well. And item number 8 is the community outreach update. So we'll invite our outreach coordinator, Tracy Rieger, up. Welcome.
Hello. So this month I provided you with a report, as I do each month, and I can answer any questions you might have about the report, but I really wanted to take time tonight to focus on the new initiative that we activated this last week during our severe temperatures. So does anyone have any questions about anything within my report? Okay.
I don't think so.
The only thing that I noted that I thought was kind of great was that the number of turnaways from both shelters had dramatically decreased this last month, so that was good to see. All right, so with the initiative of Community on Call, if you recall, last winter we had some sub-zero temperatures, really cold temperatures during the week of Christmas, and you know, a lot of our partnering agencies, we didn't really have a great plan on what to do with the unhoused, and so we wanted to be proactive this year, and out of the Housing Task Force, I was tasked along with Craig Vincent and Donna Ambrose to create an extreme weather plan to activate during temperatures that reached minus 10 degrees with the wind chill or colder. So December was a lot of planning, finalizing with that plan, and we did activate it just this last Sunday night, and Bridge Street Mission was our host site Sunday night through Friday night. And I just want to take an opportunity to provide you all with some numbers. First of all, the effort, it took a lot of collaboration and a lot of community partners, and we all were able to come together and really create an amazing outpour of care for our unhoused. And so starting on Sunday night, we sent over 7 individuals that presented to Catholic Charities to our offsite location. And I won't go through every single number, who we had every night, but I will tell you how many we sheltered each night, because I think that's the number that really matters. So on the first night, we sheltered 47 individuals. The second night, we sheltered 50 individuals. The third night, we sheltered 47. The fifth and sixth night, we sheltered 51. The sixth night, 45, and that was it. But what I can say is this. The impact that it had not only on our unhoused, because I had the pleasure of hosting them this Saturday night, is that they were extremely grateful that they didn't have to be outside and figure out where they were going to go for the night. Furthermore, I did some digging today when I was at work about how this impacted some of our local resources, such as the police department. And I want to say that I looked primarily at calls that came in about the unhoused after 6 p.m. because our shelters start to open at 7 at Catholic Charities. And I was really quite excited by the numbers. The first night we had 3 calls for service looking for shelter for 3 individuals. They were able to get housed that night. The second and third nights, no calls at all. And the fourth night, 1 call. And the fifth night, 1 call. All individuals that were calling for service to be sheltered were able to be sheltered. And so I'd like to just thank everybody who took the time and dedication and support to help us with this initiative, because I can safely say nobody died outside in the cold, because we were a community that came together and showed that we cared about this population. So I really just want to say this activation and this initiative worked exactly the way we designed it, and it certainly was life-saving for many folks.
Sure.
So.
That's huge, and that is really a first that we were able to have an achievement like that on a series of cold winter nights, which is exactly what it's designed for. So glad that it went well, and I think that, in your meetings when you originally unveiled the partnership opportunity out to the community, I think that, there was interest, but I think now that we've had experience with it, it's helpful to be able to talk with organizations that are interested in partnering but weren't quite sure how that would go. Now you can talk about that experience and, the fact that, if they volunteer to take a specific week during the year or whatever, it's easier to tell them, I think, what to expect.
Absolutely.
So-
And I think, Bridge Street Mission wanted to be the first person on call because they wanted to be able to set an example of how this works. And we did work out a few kinks along the way, but nothing that was a barrier for anyone to receive shelter. It was just minor tweaks in the process. And so we were able to work that stuff out week one. And even with those, it ran very smoothly.
Excellent. Does anyone have questions for Tracy about that?
I just have something
Go ahead,
to
Lou.
say.
Sure. Yep.
I've sat on this committee, I've been sat on this council for 3.5 years, going on 4 years now, and I watch the progression that we've made in just the last couple of years, in getting the uncomfortable steps we had to take for moving them out of downtown and the steps we've made to get people housed. And I think one of the best things we ever did as a community was hire that lady there. And once again, I thank you for everything what you do for this community.
Absolutely. Thank you for that.
Yep. Sometimes it's hard to see the impact that our staff makes every day, but they make an impact on people and on our community in a positive way every day. There's stuff to celebrate in Wausau every day. You don't usually have to look too far to find it. This is one of those things. Todd?
Yeah, I would just echo Elder Larson's comments here. I know Tracy wouldn't say this, but the amount of work that she has put into this is tremendous. I know both Chief Barnes and I had the opportunity Saturday evening to kind of peek our heads into the community room in the lobby of the Public Safety Building and see everybody kind of tucked in and ready for the night. And pretty much single-handedly, Tracy's handled all that, and it went really well. And what was my main takeaway was the expressions of gratitude that I was able to hear firsthand from those individuals that were able to be there in that setting. Expressions of being safe, being warm. Thanks for opening your building up. This is everybody's building.
Yeah.
It's the community room, and so I just really appreciate Tracy's efforts. She's doing a tremendous work.
Yeah, I think it's helpful, to also recognize that while Bridge Street Mission was our first organization, we did have a gap for a couple of those nights at the end of that week, and so the police department filled that gap. They were able to open the community room. And at first glance, we thought, well, on the housing task force, will there be some difficulty, using that facility, and will people be comfortable going over to the police department and interacting? Because I think sometimes, and mistakenly, but sometimes there's an impression that there's contentiousness between members of our unhoused population and the police, and there completely wasn't. I mean, when they opened up the community room, they served the meal, and when I had talked with Chief Barnes, people were tucked in, watching the Packer game, getting along. Officers stopped in. The vibe was very, very positive. In fact, they said they felt as safe as they could be, safest building in town, right? So, I think that needs to be celebrated. That's huge. I mean, it's great that they stepped in not only to help solve a problem and fill a gap, but I think also to myth bust some misconceptions out there that, there's not a positive relationship between these communities and our agencies. And so that's huge. Chief Barnes is on WebEx, and he has his hand up, so we'll cut to him right now. Go ahead, Chief.
Can you hear me okay?
We can.
It's unusual that I raise my hand, so I'm getting your manners. Just a couple of additional thoughts on that. First off, you heard Tracy speak about Craig Vincent and Donna Ambrose, and I think it's important to highlight that Craig Vincent is the executive director of Bridge Street Mission, and Donna Ambrose is the executive director of the Neighbor's Place. So these are examples of Tracy really working and partnering with those other nonprofit service providers in our community. And then just on the off chance that there's several hundred citizens watching us on TV right now, we're still a plug for this program, which is we are still looking for community partners and volunteers that are willing to help with the community on call. So everyone in the room, if you happen to be discussing this with other groups, please, and they have any type of interest in this, please direct them to Tracy and she can provide them with all the appropriate information.
Perfect. Thank you for that. Anyone have questions at all on Community on Call? And I think they do have a number of the weeks filled, but there are a couple available. So, like I said, agencies or volunteer groups that are interested, they know who to call now. So, with that, and I think we'll keep Tracy up front because she also is helping us with item number 9, discussion and possible action on a conceptual proposal presentation to address an unidentified service gap for transitional living case management serving our unhoused population. And these items are kind of related. So I guess, Tracy, if you want to kick off item 9, and I know you've brought a couple folks with you to talk about the proposal that's in the packets.
Actually, I think Chief Barnes is going to.
We're going to have him, Matt, kick it off? Okay. Chief, do you want to start us off here?
Sure, and I'll be brief. One of the challenges we find, as I think to Alder Larson's point, is we are working really hard to try and navigate what's really a new issue in the grand scheme of things to the city of Wausau. And Tracy works tremendously hard. We get people housed, but we saw gaps as people become unhoused and the challenges associated with that. So we found CW Solutions. I mean, it's not like they were hiding, but we became aware of them and met with them. And they seemed very like the appropriate organization to ask to come up with a solution. We don't feel at the police department that it's reasonable for the city to hire, to enter into leases for properties or to hire additional staff, 4 or 5 staff members to employ out of the police department. What we desired to do was follow a model similar to probation and parole, which is when you have individuals who are in need of services while they're on supervision, there are outside entities that they contract with to provide those services. So CW Solutions was asked to come up with a program specifically designed to assist unhoused women in our community. We know, based on our interactions with that population of individuals, that the unhoused women in our community are being victimized at a much higher rate. They are being sexually assaulted, they are being trafficked, and yet our community doesn't necessarily have any services in this lane. So we asked CW Solutions to come up with a pilot program and a proposal to be able to address the gap between shelter, like at Catholic Charities, and being housed in an apartment that they live in independently, because we aren't seeing the success there that we'd like to see. And so I think Tracy can speak a little bit more to what those type of issues she was seeing, and then CW Solutions will discuss what this program is and address any questions, and I'll raise my hand if I feel the need to chime in.
Sounds good. Thank you for that.
Okay, so I just wanted to provide you with a very brief explanation regarding statistics surrounding female unhoused population that we have in our city. I did reach out to Good Shepherd Shelter Catholic Charities to provide me with some data. So they were able to give me a year's worth of data from November 1st of 22 through October 31st of 23. During that time frame, they served 363 unduplicated guests in their shelter. Of that number, 103 of them were women. This number represents about 26% of the unhoused population in that 363. Amongst that, they broke it down for me a little bit further, and the number of women struggling with mental health issues is 71 of the 103. Alcohol, 18 of the 103, drugs 16, and mental health and drugs together 24. So, I mean, I think it's safe to say that we definitely have a population of very vulnerable people, women in our community that need services. I don't want to discredit the services that are amazing in our community that do assist women. So the women's community, where they focus really on the domestic violence piece of things, and I know we have some representation here tonight from that group, and then the Hager House. They also help women with children. So this really does focus specifically on single females who are unhoused. And you know, I have an opportunity to talk to our female unhoused population on a daily basis, and you know, recently I asked you know, about 5 of them, you know, if we had something like this in our community, would you participate? And hands down, I didn't have anyone that would turn it down. So I'd like to turn it over to Tom and Melissa from CW Solutions so they can talk through what the program looks like and answer any questions that you may have.
Okay, I think that's important. We'll go ahead and bring them up, and we know that we do have some great organizations in our community, but I think we also can't expect them to move mountains alone. So, welcome.
Yeah, thank you for having us. I'm Melissa Walsh. I'm a program manager with CW Solutions.
And I'm Tom Creed. I'm the president of CW Solutions.
And just to give you a little background, in case you haven't heard of us before, I don't think we included this information in our proposal. So CW stands for Change Within. So our organization is all about empowering the customers that we serve to make changes from within. And so our one-word mission statement is opportunity. I started as an FSET case manager, which is Food Share Employment and Training, 9 years ago. With CW Solutions, and since then we've added a lot of other programs. Some programs we operate on our own, others we partner with other government agencies such as Wood County Human Services to operate programs jointly. So in Marathon County, we have a 9-county region, but in Marathon County, we currently have about 6 different programs that we operate. So in 2021, we dove into the world of housing. We have had housing interactions in the past, but in 2021 is when we formally started operating housing programs. And since then, we have served 111 individuals from spring of 2021 through the end of 2023, just in 3 of our housing programs alone. And so our approach really with housing that I think is so important, and what Tracy does, is making sure we've got that wraparound case management services, right? So that we're traveling with folks, not just to get housing, but to keep housing. The easy part is usually getting housing. It's that maintaining. That is the challenge. However, this group of individuals that Tracy's talking about, these women who have extra victimization or extra trauma, who have intensive barriers, whether it's sobriety or mental health, or just any other barriers that they identify. A lot of our traditional housing programs will be what our housing programs are currently, rapid housing, where you're supporting someone in getting that apartment, right? And then you're doing that case management, but they're really the tenant and the leaseholder, and they're capable of maintaining that housing on their own. And we've got this gap of folks in our community that need more intensive supports than that. And so that's what this program is proposed, that it's a 2-phase. So the first phase would be transitional, where we are the leaseholder, CW Solutions, and we're providing, we have that on-site, kind of like the McClellan House was, but with more case management and more on-site support. You will see the cost of this is high due to the staff support, but that's the goal, right? To have staff there on holidays, on weekends, during the week, to be working through those traumas, through those barriers, and supporting these women with their goals for anywhere from 3 to 12 months in the first phase of what we're calling really this transitional housing, right? So a lot of skill building, psychoeducation, whatever it is that they need to work through those things, and of course bringing our community partners on board, such as North Central Healthcare, to help with those services. It's not going to be helpful, though, to just say, hey, great, you went through, 12 months of this really intensive program, now you're on your own. And that's why there would be a step 2, which I think is what's unique to this program. So step 2 is more similar to what our current housing programs would be. So the goal is that after they've kind of transitioned and made progress in that intensive stage 1, stage 2, they're getting their own unit, they're the leaseholder. They're paying for the costs, but they're still on site, so they can still get that case management support, and then eventually be, completely on their own. I know you've got the program proposal that was submitted with materials, so I can certainly go into depth on any other section that's of interest to you, but I really want to emphasize that the goal of this is we don't want to invest in a program and have it, flop in 6 months, right? The goal is to have a 3 to 5 year, really what we're calling like a pilot and test program that could be potentially expanded to serve additional individuals. And we also want staff who are going to be capable, right? This is not about babysitting. This is truly about helping people through their barriers and truly helping people accomplish their goals. And so that's why you'll see when you look at the budget of this, that you see a little bit higher cost for staffing, essentially, for this type of program to be successful.
Okay. And I think that it makes sense to look at this with a multi-year lens, at least conceptually, much like we did with the day center, and with our 365 sheltering. Obviously there has to be some stability to get it stood up and get it running real well before you can measure the results. And sometimes it's hard to measure the results in just a matter of a couple months, especially when people are on a journey. And if you have to stand up a program and staff it, there needs to be some certainty that that job is going to be there for more than 6 or 8 months. So I certainly understand the ask. I guess what I would ask of our committee, seeing how this goes, because people would transition from phase 1 to phase 2, you'd have then new people entering the phase 1. As people are working their way through, new people are coming in. It's a cyclical approach. I think that as a committee, what's being asked of us in the public health and safety realm is this a plan that we are interested in knowing more about? If it is, in my discussions in the lead up to our agenda item, was that one thing we can do is, as a committee, if we want to know more and we want to see, how this could work with partnerships, we could send a recommendation to the finance committee to find money for this. Whether that is through grant funding, whether it's through funding request, and whether it's through even partnerships with other funders. We can certainly ask them to crunch those numbers. I mean, obviously, just at first blush, 3 years of this is just under $2 million. So it's not cheap, but we certainly could ask our finance committee to undertake the money search. Chief Barnes has his hand up, so go ahead, Chief.
I just wanted to stress the point that you're making right now, Lisa, which is, we came to public health and safety because you receive information on a monthly basis about the unhoused population. And before I would feel comfortable, or any of the team would feel comfortable, speaking with legislators or the state as a potential funding source, or federal partners as a funding source, or potentially any foundations, we really feel like it would be important to, before that work gets put in and promises are made, we'd like the council's support. I fully recognize that the likelihood that the council is just going to pay for everything is very limited, but that was the motivation to bring it here first, and then move it through finance, and then hopefully start trying to determine how it's going to be paid for.
Sure. And I think that we've had some discussions about things like this too, this gap in the homelessness task force. I think the mayor was recently in Washington. She was actually trying to shake the tree at the federal level to see, obviously this type of problem. Homelessness exists in cities nationwide. Knowing that from the administration there has got to be some help somewhere. We just have to know how to access that and what to tap into. So I think that's also helpful. She's been already making those efforts to see, what may be available to help us with this, because this can't fall 100% on the taxpayers of the city and or the county. This has to be, a partner funded type deal. So What do you guys think of this in concept, Lou?
I think it's a great concept, I really do, and it's needed as well, but I think that this needs to be a council decision as well. I have to agree with the police chief because of the cost behind it and where it's going to come from. I mean, when you're looking at, let's say, like you say, a 3 or 4 year commitment, that's $2 million, and I don't know that we can come up with that at a city level. So I really do think that this needs to be, I would say let's move it on to the council and discuss it at that level, so that way everyone on the council is aware of what's going on.
I think
Thank you.
that may be helpful also. We could move it forward conceptually to have the council at least consider what we've considered here. Certainly encourage them to watch the video because that'll capture the presentation from everyone who's presented. If the council is interested in forming some type of partnership and then seeking funding, they could refer the matter to finance to find money if they're interested in it. You know, I think if we can do it either way. We can send it to finance and find the money, but then, you know, that could create some angst amongst council members that they've not seen it in concept first. You know, I'm comfortable with either approach. I think if you guys feel like conceptually we should send this to council, let them chew on this idea, see if they're interested in it as a group, because now only 5 of us have heard it. If they decide they want to know more, then we certainly could put an item on in finance to start finding money, you know, whether it's in partnership or whatever. Lou?
And then I will make the motion, we'll send this concept on to council for further review.
Okay, so we have a motion to forward this item to council for consideration. Second by Denny. Is there any further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye. Opposed? None are opposed, so that motion carries. So we'll entertain this in concept at council. My guess is that that will likely happen at one of the February meetings, either the first or second February meeting. And we'll have to see if we can maybe invite our presenters back for that meeting. There obviously may be questions that they will have that we didn't ask here, and it would be helpful, I think, to have our presenters back for that. Go ahead, Lou.
Well, and then in the meantime, maybe the mayor or somebody could look into some alternative financing, some grants or government monies or whatever,
Agree.
what's out there.
The mayor says we got it. So she has a smile on her face, so
Thank
that
you.
hopefully the trip went well, and so I'm excited to see what we could achieve here. I think that obviously many hands doing this work makes lighter work for everyone that's trying to do it. So hopefully we'll entertain this conceptually but unfunded at the council level. And if they're interested in knowing more about then how that could be constructed, they could certainly refer it to finance. So, okay. With that then, that is the last item on our agenda for tonight. I would entertain a motion to adjourn. Motion by Larson, second by Denny. Members in favor signify by saying aye.
Aye.
Aye. Opposed? No one's ever opposed. We'll stand adjourned. Thanks, everyone, and we will see you all tomorrow for council.